Welcome to our virtual town hall. I'm Margaret Quirk, Mayor of Georgina. For the next hour, we'll be discussing the COVID-19 pandemic with York Region Medical Officer of Health, Dr. Karim Kurji. Also in attendance today is our Chief of Emergency Services, Ron Jenkins. Since mid-March, we've been dealing with the COVID-19 pandemic. It's now October, and we're facing some of the same issues and many new ones. Some of our closed facilities have been reopened, but with many new health protocols. Financial impacts continue both for the town and many businesses and residents. One thing remains the same: the health and safety of our community remains our top priority. And I want to thank residents for working together to keeping our community safe. We all have a role to play in keeping our active cases low. I would now ask Chief Ron Jenkins to give an update of Georgina's Emergency Operations Center current response to the COVID-19 pandemic.
Thank you, Mayor Quirk. Happy to be here.
Welcome.
Am I coming through okay there?
I believe so. I can hear you.
Okay, thank you. Yes, as you mentioned, in early March, we opened our Emergency Operations Center, and that continues to be active throughout the course of this pandemic. Our focus has been the safety of our residents and visitors to our town by ensuring that both provincial and regional health measures are acted upon. In the early stages of the pandemic, we shut down town programming, facilities, parks, playgrounds, and beaches, as you're well aware. As we slowly begin to reopen some of our facilities and programming, we are ensuring that both provincial and regional public health measures are strictly adhered to. We have at this time reopened, as you're aware, one pad at the Georgina Ice Palace on September 14th, the Lane Pool and Leisure Pool in Sutton on September 21st, the Keswick and Perflaw Library branches on September 22nd, and the Sutton branch remains closed at this time due to some repairs. Will soon open. All protocols, safety, and health measures have been put in place at all of our reopened facilities, along with reduced hours and reduced capacity as required. Please visit our town webpage if you require more detailed information on any one of those facilities. We continue to monitor the pandemic, the impact of the second wave, and the level of risk to our residents. The number of COVID cases remains relatively stable at 173 cases, with 13% of those cases the result of close contact, 80% due to institutional outbreak, 5% due to local transmission, and 2% are currently under investigation. And credit to that relatively low number is to our residents for following the public health protocols. With direction, input, and guidance from Ontario Public Health and York Region Public Health, we will continue to monitor and adjust our operations when and if required. I'd like to again remind our residents that we are still dealing with and very much remain in a pandemic response mode. The town has developed and implemented protocols and best practices to reduce the risk at our facilities and our various town programs as we work through stage 3. We urge everyone to continue to follow the public health guidelines of physical distancing, wearing a mask when indoors or as required, maintaining your social bubble, adhering to the new limits of 10 inside and 25 outside for social events. Stay at home if you're not feeling well. And please download the COVID-19 app as part of your COVID preparedness and response measures. We must all do our part to stop the spread of COVID-19 and lessen the severity of the second wave. We need to reduce the potential impact to all of us, and especially to our vulnerable population. Now is not the time to relax and let our guard down.
Thank you very much, Chief. And I also want to take this opportunity to thank you and your EOC team for their work these past 6 months. We've worked on a lot of issues, and I know that we'll be able to handle the issues as they arise in the coming months. And I too would suggest that if members of the public have questions about how the town has responded to the COVID-19, please visit our website at georgina.ca. I now want to introduce Dr. Karim Kurji, Medical Officer of Health for York Region. Welcome, Dr. Kurji.
Thank you, Mayor. It's a pleasure to be here with you.
Thank you. I just want to thank you for taking the time today for this virtual town hall. And I know, just like our earlier town hall with a focus on the medical side of the pandemic, it will again be both informative and educational. Now, our last town hall was back on May 21st, and since then we've moved through the first wave and we've flattened the curve, and we've moved through to phase 3 of the provincial recovery plan. However, we've all seen that cases have recently started to increase, and earlier this week the province had a new high of 700 cases. Yesterday was 625, and today we're at 538 provincially. So my first question, basically, it does have 3 parts. Does this mean we're in the second wave? And what does it mean if we are? And as the town has recently opened some facilities, I am getting residents concerned that we're reopening during a time of cases rising. So maybe you can try to answer all of that in the first question that we have.
Thank you, Mayor. So around late August, we started noticing an uptick in the numbers of cases that we were experiencing. And it was difficult to say at that time whether we were entering the second wave or not. But at this point in time, we have seen definite activity, both in terms of increase in institutional outbreaks. So, we have around 9 outbreaks now, with 6 in long-term care facilities, sadly. And we also have 1 in a hospital setting as well. We also have a large number of workplaces that have been affected, with about 14 confirmed outbreaks and just under 40 suspect outbreaks. We also have just over 20 schools under surveillance. And our daily case count seems to be hovering around 40 on a daily basis. Now, there's no question that we are in the second wave now. And however, what I would like to emphasize is that our public and the residents of York Region, of Georgina, have practiced the various measures that we had advocated for in the first wave, and were able to bring this under control. And I have every confidence that if we stick to these measures, we will be able to bring things under control. In fact, we are in a much better state now than we ever were before, because we've learned a lot more about the virus. The province is also much better prepared in terms of giving us very detailed guidance, and having increased the testing capacity tremendously. We are generally very well prepared with respect to being able to tackle this particular wave down. With respect to your question about the increase in activities, so we keep monitoring very carefully whether there are any cases associated with specific activities. And so far, we haven't been able to find any great evidence linking any particular sectors with any increase in cases. But we keep quite vigilant with respect to that. And so I think the measures that people have been taking, these are the public health protocols, some of which Mr. Jenkins just referred to, have been working, to a large part. And we need to continue being vigilant
and keep up the what we're doing
right.
in terms
That's
of the physical distancing and everything. Looking at Georgina and what's happening here, what's trending now, sort of both in York Region and in Georgina itself? Are there groups or institutions that you see as hotspots? I'm just curious to know how we compare to the rest of York Region.
So like the rest of the region, most of the cases seem to originate from social gatherings or from house parties or, basically close contacts. Even if one individual in a household gets it from somewhere, whether they've attended a party or whether they have obtained it inadvertently, and no cause has necessarily been identified, is brought into the given household, and then you get a lot more transmission. So the bulk of our cases seem to be arising from close contacts, and then there is approximately 25 to 30% of our cases for which we cannot actually find any source of acquisition. Now, this is a very different pattern from what we saw very early on in the first wave, where we thought that it was being introduced through travel-related cases. Even though there are travel-related cases that now appear, these are individuals who have actually been in quarantine and have gone for testing when they developed symptoms, and we're very thankful for that. So we are able to put rings around those particular cases and their contacts quite easily. the situation is very different than that in the first wave.
So there's been a lot of emphasis recently on the age groups and the younger age group in particular, sort of having a finger pointed to them, saying that's where a lot of the cases are arising from. And it is different, as you said, from in the spring. What do you see happening here in York Region in terms of the demographics and the younger versus the older age groups?
This is an interesting question because in the first wave, we had a number of institutions, long-term care homes in particular, that got outbreaks. And as a result of that, a large proportion of our cases were the elderly. This time around, the long-term care homes seem to be better prepared to fend off any infections. Not that they are totally immune, because we're still seeing a rise in those outbreaks. However, the pattern has changed in that if you take away the elderly population from the distribution of cases, then an earlier analysis that we did actually showed that in absolute numbers, the younger population didn't necessarily increase in terms of their contribution to the current wave. However, if you take away that elderly population, then of course you sort of see that the distribution of cases is much greater in the under 40 age groups. And that pattern is changing again now, in that the distribution is getting more widespread, including having elderly folks come down. Now we think that it's the younger population that brings it into the households, and then it affects the elderly individuals. And that's how you're getting the elderly folks getting
right. It's the uninvited guest that comes along with you at whether it's a social gathering or just a family visit. And you like to think that you're safe around your family, but I think it's the social circles, and maybe you can get into that discussion about social circles and how they were working, are they still working, and where we are with that idea.
Thanks for raising that one. It's a very important subject, given the fact that you will recollect that in the first wave, when we started loosening the measures, we were still restricting people to, as it were, their close family, their own households, plus perhaps a few others, so that the numbers were restricted to about 10. Slowly and steadily, that seems to have broken down. And unfortunately, people took the license really to mix with anybody for that matter. We are urging that people get back to those particular social circles, since every individual that one associates with may have other close contacts. And so you magnify the numbers of people with whom you may be, shall we say, theoretically associating. So it is very important really that we limit the numbers of people that we associate with in order to be able to control this.
That's a good point, because that social circle can get pretty big when you start adding in everybody else's social circles. Mm-hmm. You mentioned a little bit earlier that we know more now than we did when the pandemic started in the spring. Are there different symptoms? Are there different treatments? What do we know now that we didn't know?
So there's a whole range of areas where we have learned a lot since the time the virus first emerged. So to begin with, in the very beginning, we didn't have very elaborate protocols of being able to deal with the virus in different settings. And we essentially invented them as we went along. And then as the experts were able to comment and bring together, appropriate minds together, we were able to refine those protocols. But we have, together, we have now reached a stage whereupon we have very effective central resources at the ministry, at Public Health Ontario, and at the Public Health Measures Table, as well as the Chief Medical Officers of Health Office. And we are able to have evidence-based protocols in place. The area around guidelines has really exploded to the point that you really have to know your guidelines very well to be able to manage these particular situations. But that is actually credit to the fact that the guidelines have been developed to that great an extent. In addition to that, we've had changes in the way that we thought about masks, for example. We started out by saying that, masks were not as effective, to the use of face masks, face clothes, and as source protection. Likewise, when it comes to the symptoms of COVID-19, there's been an evolution in that. And this is an ongoing exercise. For example, there have been questions about the symptoms that children present to schools with, and that is also undergoing some revision based again on proper analysis of existing data. So I think I think that the tools that we have now are more state of the art with respect to being able to deal with the virus than we ever had before. You will also recollect that in the first wave, we didn't have as much testing. I think the numbers were around 10,000 a day or less. And we had a lack of places where people could go for testing. For that matter, it was only certain priority groups that could actually get tested. And we had a lack of swabs. Well, all that seems to have been remedied. We had a lack of PPE as well. And you will, I'm sure, recollect those days. They were terrible in that sense.
Oh, yeah, exactly.
So,
And that kind of leads me into my next question. You mentioned about the number of testing that was done at the beginning, and there were times that we were, striving to get to 10,000 tests provincially. Now we're, 30, 40, 50,000 tests. The rate of infection is my next question. So the rate of infection was higher in April than it is now. We're doing more tests, so we're finding more cases. But currently the rate of infection isn't where it was in April. And maybe you can, I see a lot of things reported in the media, and I think people need to understand what that rate of infection means compared to what it was in April.
It is very important for us to not necessarily compare the first wave exactly to the second wave, because these two waves are quite different. In the first wave, as you correctly pointed out, we didn't have as much testing. So my suspicion is that the documented cases that we had in the first wave were actually lower than the existing state of circumstances at the time, because there were many people in the general public who had symptoms, but when they went through the self-assessment tool, they were urged to stay home and not necessarily go for testing. For that matter, the resources weren't there at the time. We are now in a totally different situation where testing has been expanded so greatly, even though there have been recent limits posed, but these have been done from a standpoint of prioritization so that we can use our resources more effectively. So what I'm basically saying is that even though the numbers of cases that have gone up just now in the second wave seem to be approaching those of the first wave, chances are that this second wave is a little milder than the first wave was.
Well, that is good news. So, and it's something, are we expecting to have a third wave, or does a second wave, how do we, I know there was modeling projected yesterday by the province. So just wondering, is this the only wave that we'll have, or will it build, or will there be a third wave?
So a few weeks ago, when we were trying to predict what would be happening, we had used some of the studies that were done in the States, and they had predicted that sometime in the fall, you would actually see the second wave. And my sense was that that wave would come sometime in November. So because, of course, you have the cold weather pushing people into sort of closer surroundings, you also would have influenza and respiratory outbreaks, which would really compound matters. And the public would have probably become a little lax with respect to measures for preventing COVID-19. And it is quite possible that governments on the whole would be reluctant to reintroduce measures to curtail the expansion of COVID-19 outbreaks. So with all those factors combined, and possibly with the relaxation of any travel, it seemed to make sense that there would be quite a large second wave that would come sometime in November. So we were very surprised when this particular upsurge occurred very early on. In fact, we hadn't even entered into fall when it started occurring. So I think that we can still expect something bad to happen around November. And I'm hoping that I'm wrong. And I'm hoping that this is the second wave. But somehow, whilst this is a second wave, I don't think it is the second wave.
The second wave. And I hear that being discussed. Is it the wave? Or I think one of the medical officers said it's definitely a wave. Whether it's the second wave, we don't know at this point. The other thing that is coming out now is the contact tracing, and maybe you can explain to us how that works. I've seen some charts of how it shows that multiply effect where one person can infect a number of people. So maybe you can give us a bit of details on how that works.
So essentially, the purpose behind contact tracing is to identify people who may have gotten infected and to put circles around them and prevent them from infecting other individuals. In other words, we are trying to block the transmission of COVID-19 to others. By doing so, we are essentially preventing the growth of COVID-19 in the community. Since if one case gets away, it can potentially give rise to 100 new cases in about a month's time, given the doubling time. So that is how contact tracing really works, in that, we do a detailed interview of the case and we try and find out all the exposures, where they may have had close contacts with people. Close contact is essentially somebody who spent around 10 minutes at a distance of 2 meters or less with someone else. And that usually includes household members, anyone who may have provided care, personal care to the individual, but it may even involve workplace contacts. It may even involve certain individuals that they may have spent time with without quite realizing that they were breaching the 2 meter distance. So once we've identified those particular close contacts, we get those individuals to be put into self-isolation and go for testing. And that is essentially the way that we go about controlling the expansion of the COVID-19 cases.
Great, good information. I'm going to move now into the area about testing, because that's very much in the news right now as well. So just in terms of when should people be tested? Right now, there's the nasal swab. Are there other forms of testing that are going to be available soon? And one of the things that gets asked a lot here in Georgina is local testing. And, we have to travel to South Lake. There was one testing site here that the nurse practitioners put in place. But residents are asking me if we're going to be part of the provincial program for pharmacies. So maybe just tell us a little bit about the testing and where we are with that.
Sure. Again, we've come a long ways now in that there are many other players involved here, and testing really falls under Ontario Health in particular, and they have been very good with respect to trying to have pop-up sites, in a number of locations. The one that you mentioned in Georgina is an example. However, the whole area around testing has undergone a lot of evaluation. And the issue really here is that resources are never unlimited. And as we expand the testing, the lab capacities, unfortunately cannot expand as rapidly as the ability to collect the swabs. And for that reason, it was important for the province to introduce some sort of prioritization whereby the yield of cases would be higher. Now, we in York Region, when we did our analysis, we actually found that the yield amongst asymptomatic individuals was almost as high as the yield in symptomatic individuals. However, our data is small compared to the provincial data, and much of our other information seems to corroborate whatever the province has done. So this explains the more recent restrictions around who can get tested where. And what the province is essentially trying to do is to have certain categories of people tested at the assessment centers and others be tested at the pharmacies. Unfortunately, in York Region, there's only one pharmacist who is currently doing the tests, and that is in Markham. in the Box Grove area. And I think the numbers of tests that are currently being done are only about 25 a day. But we hope that the numbers of pharmacists will expand. However, there have also been many other developments. The development of having the Abbott ID test having just been approved by Health Canada. And you also have saliva being tested in certain specific locations. For example, at Women's College Hospital, as well as Mount Sinai Hospital in Toronto. So as these developments come to greater fruition and are expanded, and it may take a few weeks, we will probably see other modalities of testing being available.
Because there's certainly a lot of research going into the testing, and I've seen on the news the small testing boxes that give the results back very quickly. So there is a lot of developments happening there, but people are anxious to, if they're trying to go into a long-term care home to visit a relative, and they need to be tested every couple of weeks, and they are concerned that there isn't something locally available. So I know you're working on that on your end, and certainly provincially our MPP is working on that as well. So it's something that we do need to have the more testing, because the more tests you do, the more symptomatic people you find with the virus, and trying to stop that spread. One question I was asked on my Facebook page was, has the definition changed for what's determined to be a positive case? And this was something that I've seen in other areas as well.
So the determination of whether a case is a positive one or not is usually made on the basis of the lab testing. As the number of players doing the testing changes, there are different criteria that are used by different labs, and the situation gets particularly complicated when you get a test result that is a little bit on the gray zone, and the interpretation of that particular test results becomes quite a challenge. There are technical jargons, like cycle thresholds and E-genes, and there's a lot of variability from lab to lab in the interpretation of those particular results. But fundamentally, the case definition of a COVID-19 case hasn't really changed.
Okay, good. COVID-19 and the flu season, that's sort of our next area. I know you've alluded to it when predicting when that second wave would happen. What are the key symptoms that differentiate COVID-19 from the flu?
I would say that it would be very difficult to be able to distinguish the two clinically, because they both have similar symptoms, whether it's headaches, myalgia, fever, muscle aches, which I've referred to as myalgia. So the only way in which one would be able to differ between those two in a solid way would be through testing. And I think if the tests that can actually be obtained rather quickly, the other modalities of testing are in place by then that would be a tremendous help. It is important that people actually get the flu shots, because by doing so, you are probably going to be less likely to get flu, and this is going to keep the hospitals free enough to take COVID-19 related cases, and will avoid that flu-related burden in the hospitals. In addition to that, it might make it a little easier for the clinicians to be able to decide who needs to go for COVID-19 testing if COVID-19 testing is at a premium at that particular point in time.
So with the flu season coming to us, and I know the need to get the flu shots, what is York Region Public Health doing to get the flu shots out and available? Are there clinics that are being planned?
So over the years, you might recollect that there was a time when York Region Public Health was the main game in town with respect to giving flu shots. But over the years, with the availability of the flu shots amongst pharmacists' offices and through family physicians' offices, we shifted away from giving flu shots directly. We would only have given roughly a couple of hundred flu shots in a given year just prior to COVID-19, since the majority of these flu shots were being given by other professionals in the community. However, our role remains one of supplying the vaccine to the providers, particularly the physician providers. The pharmacists get their supplies independently of us. We also provide flu vaccines to the long-term care homes and to the hospitals. And we provide a number of other tools like checklists that they would need to follow, particularly when administering the flu vaccine during this period with COVID-19 around. We also provide a lot of education and other support, and we are liaising with groups that can administer those vaccines amongst vulnerable groups who find it difficult necessarily to access the vaccine. But our main role this year around is to pilot some of the COVID-19 models of delivery of the COVID-19 vaccine by using the flu immunization season as an opportunity. So we hope to have at least one or two drive-through clinics for the flu vaccines and maybe one mass immunization clinic so that we can work out any wrinkles that we need to work out when it comes to COVID-19 immunization, which we hope will be here sometime in March next year, assuming that we have a vaccine to go by that time.
To go, yes. And that's the subject of a lot of online and media. Is there a vaccine? Will it be? When it will arrive? But so it's good to know that we'll have a process in place to be able to offer those vaccination clinics. My next questions are about masks. And I know you mentioned earlier that the position sort of has shifted for masks. And at the beginning, when there was such a shortage of PPEs for the long-term care and for hospitals, it was, I think, they didn't want to have too many people taking up those masks. And then it was, are the cloth masks of any use? So do the masks work? Do they help? And then sort of a second part of the question is, was that some people say that children are being asked to wear masks in school when participating in physical activity, and is that really necessary? So I'll let you cover the whole mask idea here in questions.
Sure. So the understanding around masks has really evolved, as you pointed out. And, there's a lot of evidence now to suggest that cloth masks, particularly two-layer cloth masks, are quite useful with respect to preventing others from getting infections. But with two-layer cloth masks, they also serve to some degree in terms of protecting the recipient from getting infections. However, they should never really be used as a replacement for physical distancing, but they should really be approached as an additional layer of protection. And in general, most of the studies seem to indicate that they are valuable with respect to keeping infection rates lower in a given community. When it comes to children, the evidence is a little mixed. And we are advocating that we follow the provincial guidelines with respect to masking in schools, which is really grade 4 and upwards. And for those under grade 4, those that can tolerate it, fine. So we are very much in keeping with the provincial guidelines there. When it comes to physical activities in schools, again, we have provided a fair amount of guidance to the school boards. Essentially, outdoor activities are usually safer. When it comes to indoor activities, we have to ensure that there's adequate ventilation against adequate physical distancing. And the rules are virtually the same everywhere. If you feel that physical distancing cannot be maintained, then we advocate the use of cloth masks. However, cloth masks are not easily tolerable if you happen to be physically exercising. And so it is important to maintain that physical distance in places where exercise is being conducted.
And would that include outdoors? Because I know you've talked before the difference between outdoor activities and indoors. So is there, if you're outdoors and you can't maintain that 6-foot distance, should you put a mask on? And outdoor activities in general, should a group that's doing something all have masks, even if they're outdoors?
again, what we have found is in general, transmission doesn't occur as frequently when you're outdoors. However, it is still very important to maintain the 2-meter distance from each other. But if the 2-meter distance cannot be maintained, even when one is outdoors, it is prudent to put on the cloth mask.
Okay, good advice. Moving into the questions about schools and reopenings, and certainly in recent weeks, children have returned to school both online and in person, and schools have implemented new guidelines and safety protocols as businesses and other institutions have. How safe is it to have children in school, in your opinion?
So in my opinion, the province has gone out of its way to develop guidelines that are very well thought out. And as we are finding, there seem to be layers of protection, and the guidelines are so structured as to be quite conservative in terms of erring towards caution per se. So to just point out, we have situations where you may have one individual, whether it's a student or whether it's a teacher in a given cohort, that brings in the infection from outside the school community. Well, the whole cohort is dismissed. And why is it dismissed? Because we are trying to find the source of acquisition of that particular infection. Until such time as we are totally convinced that it has actually been brought from outside the school, we are not taking any risks. Now, that would be a very different situation from another scenario. For example, if you find a case in a place of employment, the way that we go about assessing those situations is to see whether there are any close contacts. And it's only the close contacts, that is those individuals that an individual may have breached the physical distance with for about 10 minutes or more, only those close contacts are self-isolated. The rest of the individuals are permitted to continue. So you see, we are erring towards a very
Caution.
conservative approach. And that seems to have kept our children quite safe so far.
That's good. One of the questions that has come in is the list of symptoms. Will that change for students in classrooms? Because particularly, kids go back to school, they're always going to get the sniffles, a runny nose. Is that list of symptoms going to be adjusted? Because I'd heard that was going to be.
Yes, indeed. We have news that we expect information tomorrow because these are actually areas that the province has been looking at very carefully, given the fact that these symptoms were revisited in British Columbia as well. And looking at all the data in the province, and based on that, Public Health Ontario has made some recommendations. And we believe that that information will be made available very soon to us. And I'm expecting that to be made available tomorrow. And then, of course, it will be communicated appropriately.
Good, thank you. My next area of questions is going to be around gatherings and events. And we have an event coming up in a short time, Thanksgiving, a time when many families get together. I remember for Easter, we had a virtual Easter dinner where, everybody cooked a meal and we sat down doing a Zoom meeting. Should we be doing that again for Thanksgiving? Can we have people from outside our social circle inside our home for Easter dinner? And if we do, how do we ensure that everybody's safe?
So the province has already come out with guidelines, or rather requirements really, that you shouldn't be exceeding the numbers by 10. But purely from a science standpoint, it is better really to restrict the circle to the social circles, meaning your immediate household and maybe those others with whom you may have socialized in the past, but keeping the numbers down to 10. It is very important that we do this because, as I explained earlier on, unfortunately, every additional contact that you have contact with has had contact with at least 10 other people, and you just don't know which of these contacts are at the pre-symptomatic stage, and they would actually be infectious at that particular point. So the idea really is to keep the numbers of infections low should they occur. And most of our cases are arising from contexts like those, the close contacts. And so it is really important that we, for a while, do our very best to minimize these contacts so that we can all collectively bring our cases down. Once the numbers of cases come down, as they did in early August, the risks to the community all over decreases. The risk in our schools decreases, the risks in our long-term care institutions decreases, the risks in our workplaces decrease, and we could probably relax some of those rules subsequently. Although I don't see that happening very soon, given
No.
impending threat of maybe strong headwinds later in the fall.
So would you suggest that if people are having, the 10 people within their home, that people wear masks as if you were in a public area, wear the mask and try to keep that 6 foot distance, and maybe if it's nice so people can eat outside, but if you're indoors, you should try to follow the same sort of protocols and guidelines that are put in place for restaurants, for example?
So it is okay to intermingle with your immediate household members with whom you've been living with. But when it comes to anyone else coming into your household, respecting those numbers of 10, it would be prudent to keep the 2-meter distance. And if the 2-meter distance cannot be maintained, then definitely to have a mask. It's important for us even to avoid things like buffets, in case an individual happens to be coughing onto that. So take all those precautions, plus the usual precaution of not going into any of these gatherings if one isn't well, and certainly practicing good hand hygiene and all the things that you've already heard of before from us.
It's amazing when you look at the number of surfaces you touch in a home, and just as you say, passing a plate around the table, everybody's touching the plate, everybody's touching the fork. So there's ways that people can try to mitigate those things from happening. And I know that we all want to be safe. We all want to be with our families, but we all have to maintain that safety as well. Now, the next big event that's happening is at the end of October, and Halloween. And I'd ask you at a last meeting at Regional Council what we should be doing for Halloween. And some people are saying, well, if the kids are back in school, then why can't they do Halloween? So maybe I'll let you answer on the Halloween questions that I'm getting.
So with respect to Halloween, as you will recollect, at Council, I did indicate that we would be looking to the province, and subsequently I found that the Public Health Measures Table has worked on this and are about to be releasing some guidelines on Halloween. So I would prefer to wait for those guidelines rather than sort of giving you something that might perhaps be at variance from those guidelines. But the principles would remain the same. And the principles here are trying to avoid coming into contact with people outside your household. Now, how you implement that right, most effectively, I think it's best that we wait for the Public Health Measures Table's guidelines.
And I know they've been working on that, because it has been. And I remember thinking of this back in the summer, and people going, "Oh my goodness, you mean we're still going to be in this at Halloween?" And now my next question is Christmas and New Year's, and a lot of things have already been canceled, Christmas events and New Year's celebrations. Any thoughts of where we're going to be? Because I know you're talking about the flu coming, and is this really the second wave? Where do you think we're going to be at Christmas and New Year's?
So, there are still a lot of unknowns here, because in the Southern Hemisphere, with Australia practicing physical distancing and immunization with respect to the flu vaccine, they were able to curtail the numbers of flus drastically. If the same thing happens here, then we will be in a different situation. And, with physical distancing and other measures, that are deployed for COVID-19, we may be lucky and we might avoid the respiratory infections that we normally see. So if that also occurs, and if the second wave doesn't necessarily come, and the current second wave is the one that gets controlled, then I can see the possibility of some measures being relaxed by Christmas. But a lot remains to be seen. And what we've discovered with this virus is that things can change very rapidly, as you saw from mid-August to now.
Oh, I know that there was a time in mid-August, I think the provincial count got down to 33 cases.
Yes.
And then it's just gradually increased to where we are today. And that brings me to my next question. And I get this question at times, and I'm concerned about it myself personally. Air travel, that is still permitted. And you had mentioned earlier that a lot of the cases initially at the start of the pandemic were related to travel. But there's still a number, thousands of people come into Canada on a daily basis from air flights. And are you concerned about the air travel and COVID-19?
Yes, I am actually. In fact, my theory is that much of the current upswing might have been due to travel. And this would be people who may not have necessarily followed quarantine or may not have gone for testing should they develop symptoms. The ones that we know about are the good ones. These are the individuals who have respected the rules. They've followed quarantine. They've gone for testing when they had symptoms, and we've been notified about them, and we've been able to manage them. So with the quarantine rules in place, it should work. However, the federal government still discourages any non-essential travel. But that brings me again to the definition of essential travel. I think the definition of essential travel has actually withered down now. And I think there are people who are going to many places and returning from those places for purposes that were really almost not allowed in the very beginning, during the first wave. So we have a number of people that are being repatriated just now. We have a number of people who may be visiting for business purposes, and that is now seemingly permitted as being more essential than non-essential. So the pattern of travel has also changed, and the acquisition of cases is now no longer mainly from the US. Only about a quarter of our cases actually originate from the US. The remainder mainly originate from a whole host of international countries, and they are reflective of the prevalence of COVID-19 in those countries. There is a little bit that originates from within Canada travel, but it's only about less than 5%.
And I know the eastern provinces have kept sort of their bubble, but even they're seeing some new cases. And I think at one meeting several months ago now, you described this virus as being smart, and that if it will find other ways to get into the community. And I think we've seen, as we've reopened, we've found areas that it has, we thought maybe it was the resurgence might be through gyms and through bars and restaurants, and actually it's been more through private home parties and situations where there's not the same protocols. So I guess that, and we've sort of talked a little bit about it, but upcoming events, municipalities are trying to see what we can do for events in the next few months. Residents that are planning a small wedding or a small gathering, where should they be going for information on how to do that, and should they be even planning events at this time, to even on a small scale?
I think we're living at a time when it is very difficult to predict what's going to happen in the next week or so. So, for example, right now, I do know that many health units and many politicians as well are probably working on what additional measures can actually be brought to bear with respect to controlling the current wave. And some of these measures are reminiscent of the sorts of measures that we had when businesses were closed down in the first wave. Now, we in York Region currently are not finding any evidence for us to go that far, but we are having targeted sector-specific educational campaigns, ensuring that they are aware of what we are seeing in their sectors, and tightening up their particular precautionary measures. But the situation isn't the same everywhere in Ontario. And it is very possible that if you're planning any events in other health units in particular, don't be too surprised if a lot more restrictions come into play in the next little while.
Well, it certainly happened that one Saturday morning at 10 o'clock, 11 o'clock, and the size of gatherings was reduced immediately. And there were a number of people that had events that afternoon that were left scrambling. Just want to get into a little bit discussion about the information that is out there, and it's critical to get the right information out to the public. But there also gets to be information overload at times, and then you get misinformation and you get rumors. What advice do you have to people to try to sort through all the information that's out there and the speculation and the rumors?
So it is important that we go to sources that are truthful. And we believe that our particular website, Oct.1/COVID-19, is one such source. So I would be very reluctant to go to any site, but I would probably choose the government sites in particular. So our website has links to many other credible websites, and that may be a place to start. That's York.ca/COVID-19. Failing that, most of the provincial government websites and Health Canada's websites would be regarded as reliable.
And I know the York site has expanded immensely and adapted, and there's information on there from for schools that are being monitored, the institutions, the cases, the demographics, and people are always asking, well, where are you getting this information, Margaret? Well, it's on the York site, and if you want to go through it, there's a lot of good details there. A question that's just come in from somebody watching is that if a child is showing symptoms, should their siblings also stay home?
So this question is best answered in a two-part way. If the child who is showing symptoms had contact with a case of COVID-19, then yes, all the household contacts also need to stay at home. However, if the child is showing symptoms and hasn't been in contact with a case of COVID-19, then they would essentially be asked to be going for testing. They need to stay home. They would need to go for testing. And if the test results are negative and the symptoms have abated for 24 hours, they are free to go to school. Now, the best way to be able to tackle these sorts of questions is to call our lines. We are here to be able to assist members of the public. Rules seem to change a little bit from time to time, and some places also change rules a little bit from time to time. So it's best to call our lines, and we would be happy to be able to guide people through.
Good, and I always tell people to go to the source and give give the call to the public health. You're a great resource, and I've had a lot of positive feedback from residents that have been able to reach out. We're getting close to the end of our hour, but I just wanted to touch on the pandemic has been hard in many ways. We all know financially, physically, but just as important is people's mental health. And there's that COVID fatigue that people are feeling where we just want it over. You just want to be able to sit down with family and friends, give somebody a hug, just go back to normal. What do you see as the issues surrounding the mental health side of things, and what people can do to try to deal with that?
I'm glad that you brought that particular issue up, Mayor, because usually what happens is there's a tsunami of mental health issues that usually follows. Initially you have the wave of COVID-19 cases, and then you have the wave of chronic diseases that have actually been ignored, because of COVID-19. And then you get the mental health, challenges, that get manifested in terms of the healthcare system. And we have a number of resources and links to other resources through our website at york.ca/COVID-19. It is important that people recognize that these can become quite serious issues, and it is important to seek out assistance in a timely way. And there are many tips that are available, and these are available through a website, and I would encourage people to make use of those.
Good, thank you. I know you touched on it briefly earlier, but the vaccine. Do you see that there could be a vaccine available early next year? Is that your thoughts? And certainly it's all of ours desire, but do you see that as a reality?
I think with all the developments that are occurring and the emphasis on speed that has been put in place, I certainly think that there would actually be a vaccine definitely by early next year. The issue is going to be with respect to availability for the whole population. I see it being prioritized and initially being used maybe for healthcare workers and maybe long-term care homes, or maybe the elderly or other vulnerable populations first before it is made available to the general public. I know that our federal government has put enormous resources into trying to ensure that there's a secure supply for Canadians. And I'm hopeful that one will be available by around March at the, shall we say, at the latest, I hope, although there are many who believe that one won't be available until about the summer, but I'm hopeful that it'll be earlier rather than later.
Well, sooner rather than later would be a good thing. Do you have any final thoughts or comments? Certainly, your role as medical officer of health is something that is wide ranging. Any final comments on the pandemic or your role?
So I think it's important for us not necessarily to think of the vaccine as being the panacea for everything, because a vaccine may not be 100% effective, and so this may take a little longer than just after the vaccine has been delivered. So it's a sober thought, but it's the reality.
It's the reality. That's true. Well, thank you very much for joining us today, Dr. Kurji. It was extremely interesting and very informative, to spend this time with you. And I want to thank you for doing that. And thank you and your team at Public Health for all your work during these very unusual times. And I want to thank people that submitted questions today. And if you have questions that weren't covered today, please email them to us and we'll endeavor to provide the answers to you. And as I close this virtual town hall, I want to thank our senior management team for their work these past several months. Reopening has presented new challenges and concerns, and I want to thank them all for the work they've done to keep Georgina safe. And I also want to thank and acknowledge all members of Town Council for their support as we work together in finding a new normal. And again, for up-to-date information on the town's response to COVID-19, please visit our website, georgina.ca, and the region's public health page is updated daily at york.ca/COVID-19. Thank you for joining us today. Please stay safe and stay well.